My name is Heather Caton, and this is my PowerPoint regarding nutrition and critical care. Just a little bit of overview of the community. I'm doing my project over Providence Medical Center's ICU. There's a lot of change where it needs to be implemented. So at Providence Medical Center, it was established in 1886 under a different name and location. The Sisters of Charity previously owned it and has been recently, in the last few years, bought out by Prime Healthcare. It has currently been at its location since 1976. It is a level 4 trauma center, a stroke certified center. It is naturally recognized and accredited by the Joint Commission. It's an accredited chest pain center, and there are 15 beds currently in the ICU. The mission of Providence Medical Center is to deliver compassionate, quality care to patients and better health care to communities. The values are quality, compassion, community, and physician-led. Quality, we are committed to always providing exceptional care and performance. Compassion, we deliver patient-centered health care with compassion, dignity, respect for every patient and their family. Community, we are honored to be trusted partners who serve, give back, and grow with our communities. And then we are physician-led. We are a uniquely physician-founded and physician-led organization that allows doctors and clinicians to direct healthcare at every level. We are dedicated to follow our mission and values on a regular basis, and we strive to do as much as we can. Providence Medical Center has a Catholic foundation. Like I said previously, the Sisters of Charity previously owned it, but they're still very involved with the services there. They hold services in the chapel every day. They come and volunteer on all the different units and help out wherever they can and whenever they're needed. The hospital implements evidence-based practice in patient care and uses EBSCO for procedures if they are not on the internet. We rely a lot on our intranet for policies and procedures. There are protocols and guidelines for procedures as well. There are many patients who are malnourished at the time of admission, as well as those who become malnourished during their hospital stay. They are likely to develop nutritional deficits, muscle wasting, and delayed recovery time. These patients are more likely to have longer hospital stays, which in return increases the cost of the hospital stay. They have higher mortality rates, are at increased risk for developing pressure ulcers and infections, and could have difficulty weaning from the ventilators. Some patients in the ICU go without nutrition for days. So the issue is that is there any way that we could provide nutrition for these patients within 24 to 48 hours after admission to the ICU? Other hospitals have used enteral feeding protocols which have been effective. Providence Medical Center currently does not have any protocols in place regarding enteral feeding. According to ASPEN, which is the American Society for Parenteral and Enteral Nutrition, it recommends initiating enteral nutrition within the first 24 to 48 hours of being admitted to the ICU. Currently, there is not a dietitian that is in the hospital on the weekends, holidays, and they're only there Monday through Friday during the day and not even in the evenings. Some physicians do not look into depth about nutrition, and a lot of nurses unfortunately forget to bring that to their attention in the ICU because that is one of the last things that is worried about in the ICU. According to the registered dietitian at Providence Medical Center, nutrition is often not started and it's recommended that it should be started within 24 to 48 hours after admission for ICU patients. Nutrition, it has many benefits in the healing process, but unfortunately is one of the last things that people are concerned about in the ICU. On average, one bag of tube feeding costs $8. Usually the bags are 1,000 mils and get changed out every day, but a person usually goes through one bag a day. Currently, the dietitian, she rounds on the units Monday through Friday to get an update and see who's eating, who's on tube feedings, why patients are not able to eat, and how soon they'll be able to eat. There are anywhere from 1 to 15 people at a time throughout the hospital who need enteral tube feedings. The physicians at Providence Medical Center are supportive of a nurse-driven nutrition protocol because it will help decrease the delays in nutrition. Unfortunately, it will increase the workload for the nurses, but the nurses are there and advocate a lot for the patients. Nurses will be less likely to forget to ask about nutrition if something is in place where they have to assess every 12 hours for nutrition and if they are able to receive tube feeding. This mainly talks about people who are on a ventilator and who are not able to eat at this time. Some weaknesses at the facility are that there's not a dietitian in the facility on the evenings, weekends, and holidays. By having the dietitian help develop the protocol, nurses will have a better understanding of what formula patients need to be on and how much to start it at. This way, they're able to get some kind of nutrition if it is over a weekend. Say a patient comes in on Friday evening, well, the dietitian won't be there until Monday morning, so at least this person will be getting nutrition during that time. Nurses often forget to address the nutrition with the physicians. By having a nutrition assessment every 12 hours, it will remind the nurses to talk to the physicians about nutrition and hopefully get some kind of orders or something in place. There are currently no nutrition or nurse-driven nutrition protocols at the facility. By developing a nurse-driven protocol, it will help meet the standards of implementing enteral nutrition within 24 to 48 hours. Some strengths at the facility is that the dietitian follows up on patients who are on tube feedings and NPO Monday through Friday during the day. They will be able to help change the nutrition if it needs to be changed and the amounts if needed. The nurses at the hospital adapt to change well. The nurses will not be resistant to having to document every 12 hours about their nutritional status. The nurses are passionate about improving patient outcomes. By having the nurse-driven nutrition protocol, the patients will receive nutrition sooner and will improve the patient outcomes. My recommendations for this issue are to develop a nurse-driven nutrition protocol. It can help improve the delay of nutrition and meet the standards of initiating enteral nutrition in the first 24 to 48 hours, which will help improve patient outcomes. They will be screened every 24 hours regarding their nutritional status. Here are the references for my presentation, and I hope that you enjoyed it. Thank you.